Hello guys. So in today's topic, we will be discussing about Sjogren syndrome. So there are two types. One is primary Sjogren syndrome and another one is secondary Sjogren syndrome. In primary Sjogren syndrome, suppose if a patient is having dry eyes and dry mouth, then it is known as primary Sjogren syndrome, and this is also known as Sika syndrome. Sika means dryness. And suppose if a patient is having dry eyes also, dry mouth also, and he is suffering from any type of autoimmune disease like rheumatoid arthritis, systemic lupus erythematosus, and scleroderma, then we will say that this is a case of secondary Sjogren syndrome. Sclero means thick and derma means skin. So what happens basically in Sjogren syndrome, there occurs anti-nuclear antibody production. So antigen antibody reaction is taking place, and the gland is infiltrated with plenty of lymphocyte. And these lymphocyte, what they'll do, they will attack the gland, leaving behind some islands of gland here and there. So this is known as myoepithelial islands. Most of the gland is destroyed, but some part is remaining, and this part is known as myoepithelial island. So in the diagnostic criteria, we have 6 parameters, in which we have 4 signs and 2 symptoms. So first is ocular symptom. So the patient will say that he is having dry eyes for more than 3 months. And he will say that he is having sensation of sand in his eyes. Right? Second, what is the oral symptom? Same, the patient will have dry mouth for more than 3 months, and he will be having difficulty in swallowing, especially solid food. Right? Now let's see the ocular sign. So for ocular sign, we will use 2 tests. Number 1 is shimmer test. In this shimmer test, we use a filter paper, and this filter paper is generally put, suppose this is the medial canthus of the eye, this is the lateral canthus, and we put a filter paper here and we check for wetting. So suppose if wetting is less than 5 millimeter in 5 minutes, then we will say this test is positive. Then second test is rose Bengal test. In this test, basically rose Bengal is a dye. We put this dye into the eye, and what will happen basically, if the area which is not wet means it is a destroyed area. So we check how many areas are there. So if more than 4 areas are there, that becomes positive. Right? And for this we use a special scoring system which is known as Van Bijster-Veld score. Right? So this is regarding rose Bengal test. Now we have oral sign. For oral sign, we use 3 tests basically. So first, we check unstimulated saliva flow rate. Suppose if USFR or unstimulated saliva flow rate is less than 1.5 milliliter in 15 minutes, that becomes positive for Sjogren syndrome. Then we use xylography. In xylography, what will happen? Basically, we inject radioactive iodine into the gland, and there occurs a special phenomenon which is known as cherry blossom appearance or branchless fruit laden tree pattern. Right? On scintigraphy, we use radio tracer. On histopathological examination, what we will do, we will take a biopsy sample. And from where we generally take the biopsy sample? So remember, we take this biopsy sample from the clinically normal appearing area. Generally, which area is preferred? So generally, lower labial mucosa is preferred. And remember, it should not be ulcerated. Right? So on the slide, if you see on the area of 4 millimeter square, if you see more than 50 lymphocytes, then this will be considered as one focus, right? And if you see more than one focus, then we will say that this sample is positive for Sjogren syndrome, right? Now, on serological examination, we check for anti-Rho and anti-La antibodies, right? So as we have earlier mentioned that these signs and symptoms, right? If from the 6 parameters, if any 4 is positive, then we consider it as positive, right? And remember one very important thing, there is a exclusion criteria also in this. Suppose if the patient has undergone past radiation in head and neck, then he might mimic as Sjogren syndrome. Number 2, if the patient is on anticholinergic drugs. So we know anticholinergic drugs suppresses the saliva production. So the patient may have developed xerostomia, so it might mimic Sjogren syndrome. Number 3, lymphoma. We know that in lymphoma there is an abnormal proliferation of lymphocyte. Basically, these are the immature lymphocytes which are abnormally proliferated. So in that scenario also, on histopathological slide, if you see plenty of lymphocyte, then you may confuse whether it is a case of lymphoma or a Sjogren syndrome. Number 4 is if the patient is suffering from sarcoidosis. Number 5 is hepatitis C, and in cases of graft versus host disease. And remember, the lymphocytes which are there in the slide or in the gland which is attacking the gland, basically, the moment they turn into dysplastic, patient may develop lymphoma, right? So these are all about the Sjogren syndrome. And remember, there is a thing which is known as Mikulic's disease. In this, what it is basically, it is a benign lymphoepithelial lesion. It is basically a milder form of Sjogren syndrome. In this, there occurs enlargement of 2 glands. One is lacrimal gland and another one is parotid gland. And this is occurring due to, again, infiltration by lymphocytes, right? And if you find any other thing, any other condition along with this infiltration into the lacrimal as well as parotid gland, then we will say that the patient is suffering from Mikulicz syndrome. And the key point is here, in the Sjogren syndrome and Mikulicz disease, on xylography, you will find cherry blossom appearance here, but you will not find any kind of appearance in the Mikulicz disease. And if you give steroid, the patient will very well respond, while in the Sjogren syndrome, he will not respond with the steroid. So steroid is not effective, whereas in the Mikulicz disease, steroids are effective. Thank you so much.